The following is a conversation with Dr. Shikha Dhawan. She is a trailblazer in public health and social impact. With over 22 years of experience spanning biomedical research, infectious disease management, and rural empowerment, she holds a PhD in microbiology from Delhi University and a postdoctorate from the US, along with a PGDM in biotechnology business management. Currently, she is leading various programs such as being a managing director at Abhay Life Foundation and director at Share India, driving innovations in tuberculosis, HIV, AIDS, and running various labs in collaboration with Government of India. In this conversation, we have talked about the condition of healthcare in India, her experiences, and how things can be improved. I hope you enjoy this conversation. Okay, so let's start from the very beginning, ma'am. I want to start from your school life and how everything turned out. So, how about you start from the beginning days of yours?
So, Vansh and Rashi, happy to be with young folk. My mother always used to say, always stay with young folk. They keep your mind young. So, always a pleasure to interact. And now, this is the question which you've asked me to start from my beginning years. So, I want to say something, Vansh. We all are born as the most powerful human beings on earth because of our ability to think. So it's very important that life throws us a lot of options, but we should be able to choose. Now, choice is something that happens very early on. I remember when I was going around with my parents to take admission in nursery. So my preference there was cleanliness. I was fascinated by the wonderful color of the classroom. So my mother tells me that I was choosy from very beginning. For me, a classroom which looked neat and had lovely surroundings. It was all green outside. So she tells me I've been using my power to choose even somebody who has not even started formal education. So that is how I chose St. Anthony's Convent at Haskas, New Delhi. And believe me, I stuck to my choice. I completed 12th in the same school. So, something like if you have made your choices well, I didn't feel the need to pivot. I didn't feel the need to change school because it was a wonderful way we got my formal training and education. Choice also happens when you have to select languages. Choice also happens when you have to select the stream. School sets a foundation of our future years, but here I would want to tell you I selected science with biology because those times we all wanted to be either doctor or engineers. Right, that's the basic two options we all had. But now what I've realized is your mind needs to be developed to be able to understand and grasp and pivot. So I'm a microbiologist. I work with farmers. I work with self-help groups. I work with startups in different areas. So being from a formal education background in science, I was able to pick up skills on the go. And if you want to ask about my school life, I was a good student. I did very well in studies. But what I realized is life skills are more important. Marks can help you go from one level to another level, but what skills you acquire are very important. And how you take care of yourself. Health and wellness. It should be a holistic package. Be a complete human being so that whatever comes your way, you're able to have mentors, advisors, and make guided choices. Because there are certain choices we have to live with for quite some time. But then be hardworking, read, gather information, grow and more acquiring knowledge in areas of your interest. But if you think that certain other things also catch your fancy, get formal trainings in that also. so that you keep growing as a human being. And I say I'm a sponge for knowledge. I have still not stopped learning and growing bunch. So I do sit and take formal courses, trainings, and I'm a lifelong student, Vansh. So if you're asking my early years, I'm still a lifelong student. And I would even love to learn from Vansh and your friends. Why not?
Yeah.
Of course, like I was saying, if I want to do something faster, the generation is working very fast. You youngsters are smart workers. So I'll go to you and ask how to do this quickly. You always have quick answers. For me, I'll read the manual, I'll go through do's and don'ts. But if I ask Vansh, okay Vansh, how do I install this app? Oh, you'll be able to help me do it very fast.
Yeah.
So like I'm saying, I'm still learning. I would love to learn from you also. I learn from my peers also. It's always a student and a teacher relationship in all walks of life. We should never be afraid whom we are learning from. We should be open to grow and be our better versions each day. So I compete only with myself bunch. I can say I'm a better version of me each day. So that has been my early years being like. And then I did graduation in microbiology. There we learned different aspects of how microbes affect our life. So I was fascinated by the unseen world. You know, something like you say, like the best example where microbiology is in practice is how milk sets into curd. So that's lactobacilli at work. So being a microbiologist, you start saying, this is good to be eaten, this is not good because microbes are grown into it. So that needs to be discarded. So something like education and learning starts flowing in your veins. So I have seen the microbial world through that lens. And having acquired that knowledge, I specialized in infectious diseases. I went to USA for a postdoc in malaria research. And there, learning how Plasmodium falciparum is causing this infectious disease, malaria, we are trying to develop vaccine candidates for it. And this is the work. I came and joined ICGB, International Center for Genetic Engineering and Biotechnology, as a research scientist, as a postdoctorate fellow, where I continued working on specific protein antigens to develop malaria vaccine candidates. And there I did PG diploma in biotechnology management. So I told my mentor, Dr. Chetan Chitnis, that I want to be managing the vaccine trials. So something like Vansh, I'm trying to say at each stage, with my formal education and learning, I try to amass add-on skills. So like while doing my postgraduate, I acquired a skill to be doing biotechnology business management. So I told my mentor that I want to manage the vaccine trial now. So he told me, you're a researcher, but now if you want to shift as a manager, there will not be a U-turn. So, that was the best advice I got. And I told him, I want to be a manager. So there I got formally trained in good clinical practices, good clinical laboratory practices. And then I helped establish a laboratory which was doing validation for samples which had come from the field trial for malaria vaccine. So we did the phase 1 clinical trial of malaria vaccine, and I managed the full cycle because the lab was making the protein which had to be taken forward for development, for validation, and Bharat Biotech was the partner which did good manufacturing practice under GMP that produced the vaccine. Then we engaged in talks for preclinical study of the vaccine candidate, and then we went further with the CRO to do phase 1 trials in humans. So I managed the whole value chain of how a vaccine candidate moves from lab to first-in-man human trials. And then from a postdoc, I became a full-fledged manager. of malaria vaccine trials. So grew my network, was managing a lot of grants with national and international donors because Government of India was funding the initiative, the Jai Jawan vaccine initiative. It was getting funded. I was managing that trial also. And we had global partners, MVI, Malaria Vaccine Initiative, and European Vaccine Initiative. So they were also funding different aspects of the trial. Something like animal testing, human testing, and production of the vaccine candidate in the laboratory. So that's why I got to manage these trials with so many international players bunch. It was a very big learning. And we completed phase 1 trial of malaria vaccine almost after 8 years.
Wow.
I decided to move on. And then because I had helped establish good clinical practices laboratory, that is something like, good clinical practices is your standards, the way you're testing the samples, the processes in the laboratory, starting from documentation to sample receipt to testing, and how the results are quality ensured. So all these processes constitute good clinical laboratory practices. It's a very good science in itself. I'm formally trained in it. Because I'd helped establish such laboratories, the Government of India took me as a subject matter expert to expand tuberculosis laboratories also. So, it's something like the knowledge is the same, but you keep building on it. So from managing malaria vaccine clinical samples and malaria vaccine trials, I started expanding tuberculosis laboratory in the whole country with the Government of India. That time it was called Revised National Tuberculosis Program. Now it's called the National TB Elimination Program. And let me tell you, Vansh, this was the time I developed my wings and learned to fly. Because I was helping establish laboratories across the length and breadth of India, I got to travel so much, bunch. So I have been to remotest parts of Tripura where there's still no roads. So, you feel so nice when you go there to see how the government program is working, how the laboratory diagnosis is happening. And in fact, the district TB officer of Gomti district of Tripura, he had tears in his eyes when we met him. He said, "Ma'am, nobody comes so far to meet us." That was something I realized. If you want to make a difference in people's life, you have to move out of your comfort zone. Because I traveled those roads, I can't even say roads, they're not even roads. So I built my own roads bunch into people's heart. That's the day I realized you have a power to change life. And from then onwards, I've been always traveling, always have a backpack, always a foot soldier, always running around, always seeing how the health program is running conducively in the country, how health is being taken up, the services which are provided by the government health programs reach the last mile. Something like the motto is leaving no one behind. Right? And that ethos is something, bunch, I've also taken forward when I talk about empowering rural livelihoods. Because I say we people in cities get a lot of exposure, have a lot of advantages, which probably rural parts of India, people living there may not have. So I developed also this as my ikigai, a person in life, to even make their lives better. And I love eating food, fresh food, traveled whole part of the country, met locals, always had local food, which is always made fresh in front of you. So, if you travel a lot, you have to ensure your health is good, the water you're drinking is good, the food intake is good. So I always ensure I eat local. What the locals are eating, made fresh right in front of you, that keeps you going. That powers your body and soul to keep going, to make a difference in the world. So what I was saying is, I realized to make life easy for people in villages, there are a lot of things we can do. So my ikigai in life is what you do best, what the world needs, and what serves you and the world. So that's your purpose in life. So Vansh, for every one of us, if we can find our ikigai, that is the reason for us to get up every morning. And I ask this question in all my sessions, what motivates us? So name, fame, money. You get either one of this always in life. The more you get, the merrier it is. If you get all three, perfect. If you get at least one, now I'm sitting with you, interacting with you. So I'm getting to know you. We're making a human connect. So that is also important. Everything is not about money, right? We are getting to know each other. It's perfect. That's something I can carry with me, right? And of course, we keep circling back to good things in life, right? And now I was talking about my career in public health, and then that was for the tuberculosis program. Also, as a microbiologist, I have helped scale up and make quality diagnostics better under National AIDS Control Organization. So that's another government health program I work closely. And after that bunch, I realized I want to do something of my own. I want to be my own boss. That freedom, my flexibility. So I became a social entrepreneur. Now my social enterprise is called Biomedical. While I was working with self-help groups, there was a particular self-help group in Meerut which was growing flowers. So a lot of waste was left out of these flowers. So we wanted to know how to utilize that waste and to convert it into a product of value. So your feet take you where you should be. That has always been my case with me. Being a foot soldier, I'm always traveling where I need to be. So from these self-help groups, helping them to utilize the flower waste, we developed bioenzymes. Now my journey has been log judte gaye, karwa badhta gaya. Because you cannot be solely doing everything. So I have worked with wonderful people who help me train villagers, foster collaborations, and bring new products out to market. So Bioenzyme, what my social enterprise is doing, Biozazen, we take these waste material, also citrus peel, fruit peel, vegetable peel, these are actually waste. We put it with jaggery, small amount of jaggery, put water, allow it to ferment, then my microbiological mind came into play. These microbes ferment this waste material in 90 days to produce a mixture of bioactive compounds, which are something like bioenzymes. Now, if you hear about detergents, they have these enzymes for removing stain, grease, and dirt. Likewise, these are naturally produced bioenzymes with similar properties. So those can be used as household cleaning agents. They can use for foliar spray. They can use for wastewater treatment. And once, believe me, I'm still trying to find new use cases of bioenzymes. So that is something which Reliance Foundation discussed with me, and they told me also to build capacity of women in remotest areas of the country through their different projects, so that they can become empowered. So that is also something I do, Vansh. As the founder of Biozazen, I train rural women to make bioenzymes. And what best caught my interest is my aha moment, if you say, Vansh, is these women understand kifayat. Wherever I go, I make them understand kifayat first. Kifayat is something if you are using a chemical wash agent at home, for cleaning your utensils, for washing your clothes, for bathing your pet. or your own self-care. If you switch to bioenzymes, you are saving on those products. That's cost saving. Mahine ka bachat. They understand very well. So I tell them, पहले trash to value product है कि आपने जो useful product नहीं था जो waste में ही जाता, flower waste हो गया, vegetable waste हो गया, garden waste हो गया, that you're using to make bioenzyme. So use it first for your household activities, right? Whatever extra you'll make, and we'll make it a cyclic process because it takes 90 days to make a new batch of bioenzyme. So I tell them to set up a new batch every 1 week. And also if you take the mother liquor from the last batch, you can make the fermentation process also complete in 1 month. So I say first, do a bachat, make bioenzyme for yourself, then sell it to friends and families, and then extra, we'll bottle it well, we'll label it well, we'll market it.
Okay.
So that's how once my social enterprise has also grown. And along with that, my passion has taken me to different places across the world. I started working with startups because I've amassed so much knowledge from my being on the ground always. I started mentoring startups working in healthcare domain, working with different incubators, accelerators, and then I realized because I worked with self-help groups and farmers also, my interest was also into agri startups bunch and social startups. So that is how you keep expanding because I've acquired knowledge practically working on the ground. So I developed a very innovative model bunch. Self-help groups are making things which are available locally to them. So my endeavor was always to ask them what you do best. Let's build on that. If somebody was good in jewelry designing, somebody wanted to grow mushrooms, my strength was to build on their strengths, to make their strength inherent tenfold. So, and I linked them to startups. I'll tell you a very beautiful example. There was a self-help group which was growing mushrooms. So if they sell simple mushrooms, that was earning them a money. But if they make value-added products out of mushrooms, biscuits, something like mushroom chocolates, that adds protein content to the final product. That's value addition bunch. So in addition to selling just mushrooms, by making them into value-added products, they could earn more. So a packet of button mushroom was just selling for 20 rupees for 200 gram, right? But when they made it into mango pickle, they could ask more, 150 rupees for 200 grams. So it is something like value addition. And my strength is also being to make their packaging sustainable. So my condition was, you have to work with me, no plastics. So don't pack anything in plastic polythene bags. Don't pack anything in plastic bottles. Make them all put their things in glass bottles. Or because I work with self-help groups who are making dry masala also. So use paper bags, cloth bags. With me, there always been an add-on feature to be a responsible, sustainable producer and a consumer. And Vansh, I'm saying that specifically because I grow beyond against my comfort zone of working with self-help groups to become a faculty in EPR, Extended Producer Responsibility. So because I have walked the talk, I started talking about sustainable use of plastics also. Became a faculty on that. And once it grew into being a faculty for carbon neutrality also. Talking about ESG also. Those are new skills I acquired because you only live once. and time management is the key. So I've been able to manage my time well. Vansh, if you said, ma'am, we want to do a podcast without any ado, I said, Vansh, we are doing it at the first convenience, at the first time we gave.
Yeah.
So that's how you bring efficiency and manage your time. So I can say very proudly that I work with multiple organizations at the same time and have been able to give my best to all of them. And my strength is also building empowered teams. I built cadre of people who can deliver. I don't micromanage them. I have large number of teams working with me. I empower them to take decisions. I empower them to find solutions. We all can have problems, Punch. But thinking mind needs to have answers. Ask the right questions and find answers. So what I encourage my team is, tell me at least 3-4 solutions according to you for a problem. I may be able to choose you the best based on my experience. But I want to first understand from you what solutions you have thought of. So Vansh, that is something what my mentors have taught me. And this is what I'm teaching others also. So learn to think first. For my son also, I always tell him, he's a teenager, what are your thoughts? So all decisions should be inclusive. If people who are going to get affected by these decisions, you should always involve them in decision making. So that is something I acquired skills in communication also much, because I ran a Government of India program in enhancing communication for public health diseases. So I acquired communication skills also. And that led me to be a faculty of leadership in management and health. I was a student in these courses, and then I graduate, if I might say, to become faculty on those courses much. That has been my strength. And I'm always a repeat faculty, which I say is a strength, because if you are invited again and again, that shows you're doing good. So I always simplify things. I tell them, I simplify and teach in a way a common person should understand. So people relate to me, my sessions are very interactive. I love to engage with people. I love having conversations. I love to connect with the goodness in each one of us. So my journey so far, Vansh, from school to college, to malaria research, to public health programs in tuberculosis, HIV/AIDS, working with farmers, self-help groups, running global network of entrepreneurs, that's called eCafe, working with incubators and accelerators globally, mentoring startup founders, being a faculty in business and finance to young minds like you in a lot of institutes. I have really thrived.
Yeah.
This is what I can say, Vansh.
Indeed, ma'am, you surely have thrived and your journey is extremely inspirational. You have touched on a lot of areas. I want to talk to them about them very, very specifically. Let's start from the time when you had gone to US for this malaria research. So we can say like you are among that team which actually developed the vaccine for malaria, right? So could you please tell what time was it? Which year was it, and what is the difference which you had seen, which about the research which is happening in the US, because you were working in India before and you moved to the US. What do you think is lacking in research in India? And since you have been working on research for so many years, and US is such a developed country, both of these countries are doing research. What do you think India is lacking, and what kind of experiences did you have about generating a vaccine about a disease which was killing so many people and which is still prevalent, but we have developed a vaccine? The experience must have been something amazing, that you are saving the lives of the people. So could you please tell more about it, ma'am?
Vansh, what I feel is India has a lot of resources and potential. What I have felt is we are lacking in financial discipline. We have all the means, all the resources. Another thing is we should be thinking about resource sharing. All universities should not think about acquiring each and every instrument which is required, each and every facility which is required. We should believe in research sharing, collaboration, and immersion, and of course, capacity building. It was after completing my PhD in 2002, I had gone to Boston, which was affiliated to Tufts University for my postdoc, and there I started working in the fascinating area of malaria research. What I realized was that we as Asians and Indians were doing a lot of hard work in the lab, right? But this system was so conducive. If I could order a chemical reagent for my research, I could get it in less than 12 hours, Vansh. That saved a lot of time. And what I've seen back home is there are too many approvals, there are too many lengthy processes. Financial discipline is the key. We would be spending more time wasting for reagents and resources to come to us. There should be mapping of different facilities which I would want to use in my research area. And those should be approachable. Because this is what we're trying to build up. If we want to build Viksit Bharat, resources, finances, capacity building are essential to develop a future which is self-reliant and empowered by youth. So, early on, if we start building these systems and processes, a lot of money is there, but are there SOPs in place to utilize the funds? Is there financial discipline? Are audits being done in time? So the whole system is greased and oiled so well that if I could get a reagent in less than 12 hours in US, at least in 24 hours, I should be able to get it in India. That should be the aim. And what another thing I felt there was, we had access to a lot of research material. They had subscription to a lot of paid journals. So anything we wanted was available at click of a finger. That is also available in India. But now with artificial intelligence coming in, lot of knowledge we can get through. But access to authentic literature, authentic research articles, that is what is required. Students have access to internet, access to data analysis software. They should be having capacity built for utilization of big data, data analytics, acquiring new skills in artificial intelligence, IoT of things, tinkering. We want them to be more immersive and given hands-on experience. Government of India has started a lot of programs, a lot of programs for entrepreneurs, a lot of programs going in villages, a lot of programs for youth, a lot of initiatives where they are inspired and connected to network of advisors and mentors and capacity building to lay seeds of innovation and to take their innovation further to develop enterprise. Because we cannot expect the government to be giving jobs to everyone. The youth of the country has to be empowered to create jobs for the future. So that has also been my endeavor, building capacity for the youth, building capacity for startups in different areas, different portfolios I work with to bring forth a Viksit Bharat. So whatever I've seen in India, if I can talk beyond that, the time I was in US, the mall culture had not spread to India. For me, the malls came when I returned to India, but I experienced everything in US. That's what I'm saying. India is catching up to everything. So my key focus has been, why not in the remotest part of the country? The internet penetration is there. We have access to smartphones. People should be taught to use the knowledge, how to use these resources. Something like artificial intelligence is there to support us. But what are the keywords that have to be put in search so that the information you cull out can be used? Capacity building and asking the right questions to AI tools. That's also a strength. That's also a skill we can acquire. Because everything is automated. So don't be afraid to ask questions. Maintain the curiosity of a child and get the system going, make it conducive so that you are facilitated to find answers. You are facilitated to get support. You are facilitated to get reagents. You have access to research publications. You have access to mentors, advisors. You have access to finances. So please reach out, and young people should not be lazy. They have to always be go-getters and leave behind legacies that go beyond our lifetimes. So don't create for today. Create what survives for mankind for years. That's how legacies are built, Ansh.
Sure, ma'am. So, ma'am, thereafter, after you came back from US, you started to work with Government of India for tuberculosis programs. I wanted to also ask you about your experience when you were going to different places, and what impact did you had on the people. And since you had already worked in the US and now you were working in India, again I want to touch more on this topic as to what these developed countries were doing in the research, and then you came to India, and what you think that could have been more implemented, and did you even try to implement those things which were being implemented in the US in the program in which you were a part of with the Government of India. So I want you to talk more about the way in which Indian government was trying to tackle these diseases and the research which was happening specifically for tuberculosis. And I would love if you could share some of the stories when you were going to these remote places and when you were meeting with these people who were struggling and who were getting affected by these diseases.
Vansh, the thing is, government has provided processes. So state is a health matter. State is empowered to take financial decisions to ensure resources are available, manpower is available, manpower is trained. And center is also involved in disbursement of funds. What I realized is quality has to be brought in. In all walks of life, person, profession, quality processes have to be built. I'll tell you a simple example, something like when we work with the tuberculosis program, we are always saying people are not reaching to the health facility. Something like it's about a health-seeking behavior. For tuberculosis, if you're coughing for quite some time, you might think it's pollution. You might think sometimes it's a norm in certain part of the country to announce the arrival of an elder. You do so something like beyond. How do you know that you have tuberculosis? So it has some classical symptoms: loss of weight, blood in sputum, cough more than 2 weeks. So people need to seek healthcare in time. So what government has enforced is to do advocacy so that people go to these health facilities to seek care. That is one aspect. But Vansh, I have always said, what about people who reach the health facilities to seek care? Have we given them a quality assured diagnosis? For me, as a microbiologist, that has been a very crucial aspect. We do advocacy, we do sensitization, we do communication campaigns so that people are able to recognize their symptoms and approach the health facility to seek care. So quality aspects start at that level, how the person knows about where the health facility is, and once when the person reaches the health facility. What is said largely about the government system is their long waiting time. The staff is rude. I'm not saying it's a norm everywhere, But this is what which prevents us from seeking care in the health system. But I've seen the government outlay and budgets and the taxpayer money that goes into running these health programs. So if we can deliver patient-centric care with quality at public health facilities, I think we'll be justifying the money that is put into all these endeavors. And it's taxpayers' money also, it's our money also. We should understand that. So once a patient or a person who is seeking healthcare reaches the health facility, we should ensure they're treated with respect. Something I have seen in the HIV/AIDS program is stigma and discrimination with regards to if a person is told you're having HIV, we're not going to touch you. Do you think that person is going to come back again to the facility? They feel stigmatized. So something like making care for these people who reach the health facilities, which is patient-centric, takes care of their needs. Something like if women need to access the health facility after taking care of their household, are the health facilities open after 3 p.m.? No, these are something which have to be taken into account. Or if somebody is there to at least collect this specimen which can be tested to come to a confirmatory diagnostic. So these are all aspects, once when we talk about the Indian scenario, to make healthcare patient-centric. And to stagger visit schedule to ensure people are available to healthcare staff is available to take care of their needs is very crucial much. Because we go back to places about how they make us feel. If somebody treats you rudely at a health facility, you not go, you not seek healthcare there. Though the facilities have been free, or you would be forced to go a private facility where we use a term called out-of-pocket expenses. So for a common man to access healthcare in a private facility, he will be losing his daily wages, he'll be spending more money to seek healthcare, which would have been provided free of cost in a public facility. So my being in the public health is creating public goods which are of quality and which are available to common man. And another thing is why we don't use public facilities. We think they're dirty. We think we might come back with a new infection. So our endeavor is to have these facilities clean, implement quality processes, do correct documentation. Like sometimes during running a test, if the result has come non-conclusive, something like you were not able to tell whether TB was there or not, you got a non-conclusive, something like an error while testing. So a quality assured lab would call the patient again for a repeat test. Well, that is also something that is part of quality aspects function. Such a simple thing, but we miss cases because of that. And for a disease like tuberculosis, if a person is coughing, he is with us in the metro, he is with us in the public transport, he may be working in our house, he or she. So it transmits through air. It's a collective responsibility that we bring these people in the ambit of healthcare, give them a quality assured diagnostic, and then if they come positive for the disease condition, initiate them early on treatment. And then follow up to see that they complete the treatment. Because tuberculosis treatment can be long. So adherence is a problem. And when we talk about tuberculosis treatment, once that's antibiotic. So that's another key area. We're losing antibiotics. You must have heard about antimicrobial resistance. So if the tuberculosis treatment is for 6 months, For even common infections like a gastro infection, if the doctor prescribes you antibiotics for 5 days, are we adherent? If you feel better, we must stop the antibiotic early on. But for tuberculosis, the minimum treatment is 6 months. No, they're also working on shorter regimens, but classically the treatment is for 6 months. Now tell me, how will a patient who starts feeling better in a month would continue the treatment for another 5 years or 5 months?
Yeah.
So Vansh, that is also fueling antimicrobial antibiotic resistance. TB bacteria becomes resistant to these antibiotics. So a lot of stress is by the Government of India program to ensure that patients affected with tuberculosis who are initiated on treatment complete their full course of treatment. Because if they become drug resistant, those treatment durations are longer and more resource and money intensive. Right? So all these aspects are what you understand when you work in the public health system once. So this has been my learning to ensure diagnostics are quality ensured based on correct diagnostic, which we call diagnostic stewardship. The correct antibiotics are started, which is called antibiotic stewardship. Because we have to save these antibiotics for all of us. Because if patients who reach ICUs or in a critical disease condition, you don't want them to be acquiring pathogens which are resistant to antibiotic. With so much widely available of antibiotics without a prescription, and we have seen in COVID, because of viral disease, people were popping antibacterials. Antibiotics work against bacteria, not viruses. So all these indiscriminate use of antibiotics is also fueling AMR. So the government has taken a lot of precautions for this. These specific antibiotics are prescription drugs. They're also given a red line on the pills on the back of the blisters, because they can be only sold under prescription. After a doctor has explained the course, also side effects and how long the treatment should continue. So all these things need to ensure that we create a safe world and leave a safe and a healthy world for the future generation also.
Amazing, ma'am. I want to discuss more on the public condition of public health sector in India. There are 2 points which you mentioned. One was financial discipline, which was lacking in the research part of research sector of India. Another very important thing is how health sector, if you want to get good treatments, you really have to go to private hospitals. If you are relying on government hospitals, it is very rare that you would be able to get really good treatment. And even if you are getting good treatments, the lines are very big, and it is just seeming in such a way that public health sector in India is not really working that well, especially for such a large population. And the behavior.
No, I didn't say that. Working very well.
No. Yeah.
I just said how to make it better, Vansh.
I'm just telling from my experience, ma'am, that if you really want good treatments, you have to go to private hospitals. Public health sector in India can be doing very well. The point which you were mentioning, the behavioral one, it is really true that if the patients are not treated with respect and if they are treated in a bad manner, they certainly would not be coming back. But I want to discuss on the point how you think that the public health sector in India is working well.
It's working beautifully. We have targets to eliminate tuberculosis. We had the target till 2025 and the new target is 2030. The thing is, if diagnostics, treatment, quality assured processes are built in, and there are a lot of community-based organizations which are supporting the endeavor bunch. So it's a collaborative effort. When we talk about taking care of a health problem for the country, a lot of good is going in the field. I'm saying we can do much better.
Okay.
If I ask you why you don't go to a public health facility, something like if I have to ask my family member also to get a chest x-ray done in a public facility, they're very reluctant.
Mm-hmm.
So, you know, in between cleanliness between patients, long waiting hours, the staff may be rude, there may be long queues, a lot of time goes into it. So how we can make it better? Something like, you know, health programs, we have seen tuberculosis and HIV patients are assessing healthcare in the same facility. So if a TB patient is coughing, HIV person is a person affected with HIV is immunocompromised. There's a weak immunity. So he's the first one to get the tuberculosis bacteria. So, you know, prioritizing HIV patients there, fast tracking their diagnosis and treatment so that they don't intermingle with other people who are seeking health care. These are all initiatives government has done. So, and also something like talking them about cough etiquettes. They should not be spitting everywhere, use a mask or cover their face or to cough like this so that the TB bacteria are not aerosolized. So this is part of the communication strategies and campaigns which I was talking about. I have supported such programs with Government of India. We are trying to make them no spit zones. We are trying to create advocacy about how to give a good quality sample, how to get a quality assured diagnostics, how to be adherent to your treatment. So I told the adults, the program is doing very beautifully, and we have seen pockets where the TB case diagnosis in the country has also increased. A lot of good diagnosis is also happening from the private sector. TB is a notifiable disease. Private sector is also notifying disease to the Government of India program. You know, we say a term something like public health action. If a TB case is diagnosed, it is must to see that the family is also checked. The family is also tested for tuberculosis because it's airborne. If a TB affected patient has lived in that household, the family needs to be, and the close contact need to be checked first for tuberculosis. And after ruling out tuberculosis, they have to be put on a chemoprophylaxis or a preventive therapy. Because they'll be with a tuberculosis patient, they have to be prevented from getting and spreading more TB. So that is public health action which gets into force after notifying TB. So that is very important bunch. And something like to know if the tuberculosis bacteria is drug resistant or not. Right? All these things come once a TB case is notified. That comes under public health action. That's why the Government of India should know every TB case so that the public health action gets triggered. His contacts, friends and families are also tested for TB, and if their children below 5 years of age, they have to be definitely put on preventive therapy.
Yes,
this is public health action that kicks in. And it's so much going on in the government health programs. The programs have been beautifully designed. There are experts who are updating the policy and guidelines, and I've also been involved in policy update to a lot of government health initiatives. So they update the policies, update the guidelines, and build capacity of the health cadre to deliver these quality principles in healthcare.
Now,
but like, sorry to interrupt, I just wanted to complete.
Yeah.
Private, like you were saying, let's make the public health system and the public health facilities so clean that a common man should not even think twice before going there. That is something you should help us to do. The youth should help us to do. Raise your voice. Raise voice about cleanliness. Raise voice about rudeness of the staff. Raise voice if you see people spitting here and there. These are etiquettes. People could be, automation processes could be given. People should be, now they've started, if you book appointments in government hospitals, they give you a time slot so that wait time is reduced. In Delhi, you can access the best of healthcare in government hospitals, putting your Aadhaar and Aabha number to get a time slot with a specialist. So, all these things are coming in, and we need your support to make the health system in the country better.
Yes, ma'am. I would like to tell about myself personally, ma'am. Just after having this conversation, initially what I used to think, because if whenever I'm having some kind of cough or fever, I never think that I'll be going to the government or the civil hospital of my city. I always go to a private hospital just to make sure that the treatment which I will be getting is going to be good. The same thing which I see for the people who are all around me. So the perception which me and the people all around us were having was that the condition of public health sector in India is not really good, and the people, if you really want a good healthcare, if you want that you are treated in a better way, you should be going to the private institutions. But you, as an expert, as you yourself told, you have changed my mindset, and I hope that you have changed, that the audience which will be listening, their mindset would also have been changed. But do you agree that all of these uh, actions which are taken by the government of India in order to make sure that the public health sector is improving, maybe there is a lack of communication between them and between the people who are present, because these people who are coming from maybe who are not really financially well, and who are waiting in these long queues, and maybe they would not be able to know that how to register themselves for an appointment, or how to get with all of these things. So that was the point which I was trying to make. I was saying that maybe, and I personally think that the condition of public health center in India is maybe not that good, and now I'm kind of confused. That is it good, or what would you call it?
I can say much. It's a mix everywhere.
Okay.
Like the place I live in
Mm-hmm.
is a government hospital there. Sparkling clean.
That's Delhi though.
That's Delhi.
Yeah.
But if you talk about other places, yeah, they're trying to do best in the limited resources,
Mm-hmm.
but we can always ask for better services. We always encourage grievance. Complaint box should be there. Tell your complaint. Reach to ensure it reaches to the person who is able to make a decision to make a change. The superintendent of the health facility, or its affiliated health facility, is part of a big government hospital. Ensure the voice reaches to the decision makers. If nothing works, go to social media and post about it.
Yeah.
Bring the change. Because all these government and public health facilities are built using taxpayers' money also. You should be using them. And believe me, this is nothing against the private sector. But if you talk about footfall, right? A government hospital, even an intern in a government hospital would have seen 100 plus cases in a day. So their on-job training, their on-job acumen in really dealing with patient symptoms is much higher. So their experience adds on. In a month, the number of cases they see compared to a private facility where you have convenience of no wait, a scheduled appointment, how many cases they have seen in a day? Especially the young doctors. I'm not talking about experienced doctors in the private clinics. We go to them for their clinic, their expertise and years of practice. But if you see in a private clinic, your history or the medical records are taken by a young fellow. How much exposure he has had compared to a government health facility? If you look in those lines, I send all my friends and family to government health facilities. And they go. Because the people who attend to you are more experienced. You see more cases in a day. And then the specialist is something you go for. And there's another thing, Vansh. if you could actually counter argue if government facility are seeing so many patients in the day, are they spending time with patients to collect history or not? You know, we can argue at different levels,
Yeah.
but they have done so much documentation, they're trained in public dealing so much that they're able to capture the essence very well in that short conversation with patient while taking history, while deciding what test they should undergo before even meeting the senior doctor. So, you know, all that system are built in place. I think experience of a healthcare professional really matters a lot, because I can tell you an experience from a private sector, a hospital, a young doctor was taking x-rays every day for a patient with pneumonia to impress his senior so that he could give a readout of the x-ray result every day. I had to intervene that day. The patient has pneumonia. Do you think every day the lung picture will change? That you have to take an x-ray every day? But he was doing it so that he could update his senior. So now I had an audience with the senior doctor who told me, you don't need to expose the patient every day to x-ray. Lung picture won't change so fast. You can do it weekly. So, you know, these are also the things we have seen. Again, I would say the choice and the power to decide. We should be able to do that. Like, we'll go to a health facility because of the specialist, the seniority. Likewise, if you want to go to a government health facility, our first criteria would be cleanliness, good staff, the diagnostic facilities are available, doctors are available. That's also a criteria, no? You don't want a lab technician to be attending to you. And these facilities would not be open at a time convenient to you. So you have to ensure you reach them when their OPDs are open.
Yes, ma'am. Now I want to move on to the part of the purpose. You know, ma'am, there's a lot of philosophy out there. There is a lot of text out there about what is the meaning of life and what is the purpose of life, what is the happiness. And one of the very general advices which people get is that you are the most happy and you are able to find the purpose of your life when you are serving the society. As doctors and as a researcher, and you have gone to so many places and you have gone to the remotest parts of India. How has that changed in how you look at life? You have kind of switched yourself from being a researcher, you're still a researcher, and then you chose that you'll be helping people by going on ground. I want to know what was the reason for doing that, and how much have you changed, and how much has the perspective of how you look at life has changed? Because I'm sure when you interact with these people and you see that they are having so much scarcity of resources, and then when you compare them with yourself, you must be getting a lot of different kind of thoughts and your perspective towards life and how you should be giving out your life for the good of people, and the legacy which you were talking about. I want you to talk about these things, ma'am.
Vansh, I could summarize what you have asked in an equation. H is equal to IJ.
Okay.
Happiness is an inside job.
Inside job.
You have to choose to be happy. Happiness comes from within. Happy people deliver. And happiness is a mind state. Something like if it rains, you can either worry about traffic block, or you could actually enjoy the rain. It's a mindset. You can choose to be happy once. And I've always chosen to be happy. And this is what I understand with people. There is stress, there is limitation, there are a lot of things which can pull you down. But you have to find that within you what keeps you going. And I'm like a spring. Spring is something which you compress. Any adversity will compress. But it jumps higher. The more it is compressed, it jumps higher. Choose to be happy, have a happy mindset, have a positive outlook in life. Because I've seen people where the passion of the staff, their enthusiasm has made healthcare accessible. Even resources are limited, even a particular tube to collect patient sample is not there. They have really made the superintendent get them from internal funds those collection tubes. And at the same time, I have also seen facilities, they say the collection tubes are not there, facility closed. It's all about mindset. So I asked this particular person, you could have quietly sat if the consumables are not available, if the collection tubes are not available. What made you do that? He said, I'm paid for this job. I want to do it to the best of my ability. So he has a very positive and a happy outlook to life. That's how we all can also behave. If it's not there, we can stop the work. Or we find ways or detours to do it. And happy people always find ways to accomplish tasks. If you have negativity in you, you'll keep complaining, you will keep grumbling. Okay, Vansh, I would like to say something about a blame game, which we all practice as humans. I like to give my own example. If I don't take my morning coffee, I will not work efficiently today. I shifted the blame to a cup of coffee in the morning. But that is not an excuse for me not being efficient. So we all try to shift the blame. Finances were not there, collection tube were not there. Once you stop shifting the blame, you start finding solutions. That's how things work, Vansh. But we as humans are very happy to blame because that takes the accountability away from us. If you stop the blame, become more accountable, become more responsible, more can be accomplished, Vansh.
Yes, ma'am. Sure. That is such a beautiful perspective that you can always choose to be happy regardless of the conditions in which you are in. That is really, really inspirational. Now, I want to talk about the entrepreneurial journey of yourself, ma'am. You not only are having your own startups, but you're also working with other people. Specifically, you're working with farmers of the country. Agricultural sector is one of the largest contributing sectors in India, and its efficiency has to be increased if we want to become a developed nation. How has your experience been with the farmers? Because since years we are having the conventional ways of these farmers are using in order to grow their crops, in order to sell these crops. We always hear cases that the rate at which farmers sell their crop is very less, and the rate at which people get the same product is really high. So the profits are being made, but they are not able to get to the farmers of the country. You are working with them in order to help them to increase their the amount of money which they are getting. I want you to talk about the experiences which you're having and the problems which you face when you're working with these farmers who are not maybe that much aware of how they can become more financially independent. And I would love to know the stories which you're having about these.
Vansh, I can talk about this as well. Thank you for this wonderful question. Farmers are real people. We are an agri-based economy largely in India. These people have ears to the ground. Literally. They are not formally trained, may or may not be, but they understand what government subsidies are there, what government initiatives are there. They are very quick to adapt. I have heard from farmers in Mirzapur in Uttar Pradesh that we have to grow dragon fruit. We have to grow kiwi. That's a high value crop, fruit crop. They have become so innovative and enterprising. I heard from a farmer about green credits. He said, if I can plant more trees, in 3 years, I'm eligible for green credits. I'm like, wow, he's so practical. And then there's one farmer who tells me there's a lot of cow dung in the village. I want to have a business around cow dung. How you can have a business around cow dung? He wants to sell them to a industry which is making briquettes. Briquettes, then he sells to a company which uses it in their boilers for heat generation. These people have become so innovative, they are trying to build in automation also. Like when we talked about the drone projects, there was the drone Didi project. They are actually going to government centers for upskilling, getting trainings done. A particular farmer took drones on loans because he realized government is training drone Didis. Right? So drone Didis are also having their drones, but he at the same time on rent had drones which he was giving out to farmers for spraying water and monitoring health of the plant. They are so quick to adapt to government initiatives. They are attending these meetings where the government officials are holding on a regular basis. They are getting themselves updated, and there is a lot of penetration through radio, Vansh. That's still a very powerful means of communication, radio and TV. Doordarshan. They may not have internet, but they are listening to Doordarshan. They know which seeds have to be planted, why dragon fruit should be planted, why high revenue bearing kiwi should be planted, how to take care of the particular seeds. They're listening and adopting. And I have also done projects in capacity building to link them with startups. So startups are directly taking their produce, adding value to the produce, like I said, for self-help groups growing mushroom and for farmers growing tomatoes. If we link them to manufacturers making ketchups. It's so simple, Vansh. Once you are in the ecosystem, you understand and you discuss with them how they can make more profits by selling directly. So I have worked with National Cooperative Union of India. These farmers are organized into farmer producer organizations, and we are also helping them to develop cooperatives. National Cooperative Union of India is the apex body for cooperatives in the country. So this is providing marketplace to them. The system is so beautifully laid. They're also providing logistics support. And they're also putting their products in their physical stores. So, like you were saying, there's no middleman. The direct sale of their products goes back to them. And if they have to ship their products, okay, first of all, their products are listed on the government websites also, e-commerce portals also. They are also given training to put their produce on the other e-commerce platforms also, in addition to the government systems. So they can do direct sales much. And my add-on has been to make it sustainable. Use glass bottles, don't use plastics, use paper cloth as per the need of your product. Maintain quality. For food products, get FSSI label. Put your shelf life on the product. If it's a perishable, ensure it's hygienically packed. You've used a clean facility for packaging. I have actually also linked them to people who make sustainable printing for the packaging material. So Vansh, it's a very big ecosystem. Once you are in the field with them, you realize what is lacking, you help them build up with available resources, get startups, or get other industries to partner with them, so there can be direct sales. And my consultancy fee is the fresh vegetables they are growing, the fresh berries and mangoes. I get mangoes ripened on the tree. That's my consultancy fee for working with them. So it's been a very pleasurable journey, Vansh, because everything is not about money. And I have not purchased clarified ghee for so many years. I get it from the farmers, straight to home. So farm to folk. That's also a life I'm living, Vansh, by working with these people who have ears to the ground, my farmers.
Amazing, ma'am. Now I want to talk about when you were a faculty in EPR, ma'am, and all of you people were also working about carbon neutrality. I wanted to touch a little upon the climate and the pollution which is happening in India. Uh, we see a lot of people just blaming these political parties about pollution and everything. I want you to talk about what really is the cause of it and how can we really get rid of it, because even if we see outside, especially now winters are coming, all of these things are going to increase and increase and increase, and somehow it just seems that we are not able to get to a solution. Other countries are having such great climates and such clear weathers. On the other hand, when you come to India, especially in Delhi NCR, you see fog and it just seems like dust is in the air. You have worked on these things. I want you to touch about the reasons and how we really can get rid of all of these things.
It's the blame game or the feeling that one person cannot make a difference. The change has to begin with us also. Are we refusing plastics? Have we ensured we use good quality fuel? Have we ensured our automobiles have a pollution check certificate? Have we ensured sustainability our end? It's very easy to blame the government, very easy to blame the system. It's very easy for us to be sustainable. It's very easy for us to be saving water. It's very easy for us to be growing plants indoors, outdoors, maintain greenery around us, segregating garbage, supporting in waste management and recycling, and overall contributing to a healthy air. Construction never stops. That contributes so much to air pollution. Right? We may say burning of crop residue is a major problem, but the thing is, there are a lot of government initiatives and a lot of policies which have come up to stop burning of stubble. I have seen a lot of startups which has come up to ensure circularity. So waste from one, like the agri waste, we can say, becomes a raw material for another industry. A lot of startups which have floated the idea of making biopolymers, bioresin, making packaging material from agri waste. A lot of thrust has to be given on that. A lot of advocacy and sensitization has to be done with regards to farmers not burning their agricultural waste. Have we given them options? Have we given them options for buyback? All these are happening. So the change begins with each one of us. We have to be eco-conscious consumers ourselves first. Like government can keep on banning plastic polythene bags, but then we carrying our own cloth bag to the market. These are the questions. And once I have been plastic free for years, I have even stopped using paper cups. So I carry my tumbler on flights also. So the change begins from us, and each individual can make a difference. It's about discipline, and it is about feeling that I can also make an impact. It's about raising the collective conscience. If you clean your house and throw your garbage outside, you need to realize that's a common passage also for all of you. So minds need to be cleaned to take care of pollution, environment deterioration. We need to be conscious consumers. Start refusing things which are not good for the environment also. Reuse, recycle, upskill. Because what all is contributing to pollution is a lot of plastic, cloth waste, which is going from our households. The amount of metric ton of waste Delhi is generating one day itself, we can think of recycling. We can, like we did bioenzymes from fruit and vegetable peel waste. We can think of composting. I grow a lot of plants. I have my own compost pit. Societies, resident welfare association can take up composting initiatives. That saves money also, is good for the environment also. Each one of us can make a difference and trust the system and the government to bring about the larger change. We have initiatives seen like on bus stops. They are growing, they are putting plants, they are putting a lot of greenery. Government is taking so much initiatives. When the AQI really falls during the harsh winter conditions, they are sprinkling water from the top at places which are generating maximum pollution. We at our level, let us be responsible citizens first and trust the government initiatives. But if the AQI falls down yet, we should be using face masks, we should be using air purifiers, because we have to ensure we are healthy and not breathing so many cigarettes in a day.
Yeah, right, ma'am. Ma'am, you are into so many things and you are managing so many things at once. I really want to know, how do you manage your time in such an effective manner? Could you please give us tips about time management?
Discipline is the key, Vansh. I try to do things in the first instance with quality, because it takes more time to undo and to correct the changes required. So I put my best foot forward in the first instance also. That's doing work with quality. I deliver the best in the first go. I do my research. I build good documentation. I empower my teams to deliver quality in the first instance only. So work hard, but deliver with quality. And discipline with regards to completing what you say you will deliver. Something like I'll say, Vansh, I'll come for the podcast, so I need to show up in time. That is the key. Show up, do things with quality, and manage your time well with discipline. Because anything without a timeline is a wish list. Something like we keep piling those books to read. We keep piling those recipes to make. Just go ahead and find time and do it. So that you make new bucket list, you make new wish list. Keep on ticking your bucket list in time.
Yeah, ma'am. Now we have arrived to the end of the podcast. I am trying to build a section of this podcast that when we are coming to the end of the podcast, what advice would you like to give to the audience, to the young generation of India? And we would love if you have some end remarks for this podcast.
So my favorite thing is always bunch. The takeaway is H is equal to IJ. Build your own happiness. Don't depend on anybody to make you happy. It's a mindset. Choose positivity and create legacies. You all have inherent potential. Harness that. Use it. Never be shy of hard work, but always work smart. Leave something for the world. Build for mankind. Thank you, Vansh.
Thank you very, very much, ma'am, for taking out your time. It was amazing talking to you. I'm sure that the people who would listen, they would learn tons and tons of things through this conversation. We are truly, truly grateful to you, ma'am. Thank you so, so much for your time. Thank you, ma'am.